Good day. Today, I will be demonstrating the vital signs, which is a physiologic measurements of the neurologic, metabolic, respiratory, and hormonal and cardiovascular status of the body. They include the body temperature, pulse rate, respiratory rate, blood pressure, and oxygen saturation. These measurements are utmost importance because they are the basis for identifying physiologic disturbances or even life-threatening health conditions. Thus, vital signs are monitored periodically. And the pulse rate, it is the wave of blood that created by contractions of the left ventricle of the heart that is regulated by autonomic nervous system. So today, I will going to demonstrate the assessing the temperature. So first, greet the client and introduce yourself and verify the client's identity. Hello, good day. My name is Aubrey Milebres and I'll be your student nurse today. So, can you verify your name, ma'am?
Uh, Tyra Nicole Reyes,
Your birthday please, ma'am?
March 26, 2002.
Okay, thank you, ma'am. So, is to sanitize to prevent cross-contamination. Then, close the curtains to for the privacy of the patient, for the patient or the client. And then, alright, so I'll be taking your vital signs today, ma'am. So, the second is ensure the client is a calm and quiet as what the client did for the past 12 minutes if the patient was engaged in a strenuous activity and allow 10 to 15 minutes to rest. So, ma'am, can I ask if it is okay, what did you do at the past 12 minutes?
I'm just sitting in my bedroom.
Oh, okay, ma'am, thank you. For today, I will checking your vital signs, which is it is important for us to know that if there is any problem with your health condition. The vital sign is it consists of 4 elements, which is the body temperature, pulse rate, respiration rate, and the blood pressure. Expose the patient axilla by securely folding the client's shirt sleeves or gown up to the deltoid region. So, ma'am, can I fold your sleeves? Then, if axilla is moist, dry it with the patient's towel using patting motion. And after that, with a cotton ball, wipe the thermometer. And after that, remove the thermometer from the container. Then, with a cotton ball, wipe the thermometer in a rotating motion from the temperature sensor for the neck. Then place the thermometer in the center of the patient's axilla. Okay, can you raise your arm? And after that, assist the patient to place their arm tightly across the abdomen to keep thermometer in place. And then wait until the thermometer will buzz. Now the thermometer is buzzed, so we'll check the temperature of the client. Ma'am? Oh. After that, use the cotton to then note the temperature of the client. Ma'am, your temperature is 36.0 degrees Celsius. note, remain holding the thermometer in place if the client is irrational or is very young. Thank you. And the pulse rate, it is the wave of blood that created by contractions of the left ventricle of the heart that is regulated by assisting peripheral pulse. So first is to assist the client to a comfortable supine position or to a sitting position on a chair or at the edge of the bed. Second is select the pulse side point. Normally the radial pulse is taken. Ma'am, I'm going to take your pulse. Then observe the first minute, the regulatory of the pulse. Count for 1 full minute. Note the pulse rhythm and volume. One is the respiratory rate, the act of breathing, transport of oxygen from the atmosphere to the body cells, and transport of carbon dioxide from the cell of atmosphere. So now I will be assessing respiratory. So first, feel the raise and fall of the diaphragm while supposedly taking the radial pulse. Then count the RR in 60 seconds on one inhalation and one exhalation are counted as 1 second. So, ma'am, inhale. And then, when abnormal breathing pattern is noted, use the next 60 seconds to carefully observe the characteristic of the client's respirations. So, okay, your respiration rate is
Normal.
So now, note the rate, deep, rhythm, and characteristic of respiration. Then, refer any abnormal findings or any compliance for the clients. Example is the difficulty. And then next is blood pressure. It refers to the force of blood against the arterial walls and maximum blood pressures exerted on the walls of arteries when the left ventricles of the heart pushes blood through the aortic valve into the aorta during systole. So now I will be demonstrate assessing blood pressure. So first, position the client appropriately and allow 10 to 15 minutes rest. If the patient is engaged in a strenuous activity before a BP assessment, in a lying position or sitting with arms at the side, palm facing up, in a sitting position with arms slightly flexed, the forearm supported at the heart level and facing up. Then, fold the patient's shirt, sleeves, or gown up to the shoulder, making it sure it is secured and will not fall to the bronchial area. And then, ask the client not to speak when BP is being measured. So, ma'am, not to speak when I'm starting to BP measured. So, smoothly and evenly apply the cuff with its lower border located at about 2.5 cm above the antecubital space. Then, ensure the tube is placed in the line with the bronchial artery. So ensure the tube is placed in a line with the brachial artery. Then, make sure the cup is not fully fitted by the inserting your two fingers into the BP cup. Then, position oneself so that the manometer is vertically at the eye level. Observation should not be farther than 1 m, approximately 1 yard away. That's a joy. Then, insert the earpiece of the stethoscope in your ears so that the tilt slightly forward and be sure sounds are clearly not muffled. Then, ensure that the stethoscope hangs freely and it's not contact with any object. Then, warm the diaphragm of the stethoscope. And also locate the brachial artery and place the diaphragm at the stethoscope over the brachial pulse. Then, secure the chest piece by placing over the palm and that dominant hand over it. Close the valve at the pressure valve clockwise until it is tight. Then quickly inflate the cuff until the last sound. Then quickly inflate cuff until the last sound. Then quickly inflate cuff until, and then slowly release, open the pressure valve and allow the manometer gauge to fall at rate of 2 to 3 mmHg per second. Then, note the point on manometer where the first clear sound is heard. The sound will slowly increase in intensity. Continue to deflate the cuff, nothing to the point at which sound is suppressed. Listen for 10 to 20 mmH after the last sound. Then allow remaining air to escape quickly. Then remove the cuff from the client's arm and assess patient to assume a comfortable position. Cover the upper arm and it was previously clasped. And assess patients to assume a comfortable position. Cover the upper arm, it was previously clasped. And then, note the point on manometer where the first clear round is heard. The sounds will slowly increase in intensity. Then, discuss the findings with the client and do health teaching as needed. And after that, wash hands or sanitize to prevent cross-contamination. Then, after the documentation, chart in TPR BP sheets according to the hospital policy. Then, report abnormal findings of vital signs. Then, report any alterations, observable signs and symptoms of the patient. Then, patient's reactions. That's all. Thank you.